Have you researched grief content and felt like it's not that easy? It's not a normal process. There's nothing about how I'm feeling that feels normal. And then you come across this prolonged grief disorder. Prolonged grief disorder, by definition of the DSM, which is the book we use to diagnose, prolonged grief disorder is there. And now maybe you're thinking, oh my gosh, there's something wrong with me. Why can't I feel normal in this process? What if it's more than grief? This video is going to have it to reframe that. Yes, it is likely more than grief, but this prolonged grief disorder, as if there's something wrong with you if you're not done grieving by 1 year. Some grief, my grief, probably your grief, doesn't even get started till 1 year. My name's Cristi Bundukamara. I'm a psychiatric nurse practitioner, but more importantly for this topic, I have lost children. I've also lost my husband. So I know grief intimately. And I can remember that, as I was going through these different grief processes, I've actually lost 3 children. One in 2005, 2016, and most recently 2021. And in that first year of losing a child, it's survival mode. So if you've gotten past the first year, I want you to not be thinking, what's wrong with me? I want you to be thinking, I made it. I've made it this far. Now what do I do? Is it more than grief? So I teach what I call a grief intensive, where you come to me for 3 days and we spend the first day really studying grief. But then we also learn to separate the grief from the trauma. And losing a child is traumatic grief. It's not the same as just grief. And so we learn how to separate the grief from the trauma so that the pain of the grief is honestly going to be with you forever. Even if it's not that of losing a child, right? On me and my husband's anniversary, I will cry and take time for myself and allow myself to feel the pain of losing him. The same with my birthdays, my kids' birthdays and the anniversaries of their death. Holidays are hard. Or maybe there's just some random day that's really hard and painful. That grief will be with me forever. The pain and intensity in which I need to feel it, in which you need to feel it, should decrease. But let's talk about if it's more. If it's more, if it's entangled with the trauma. If you're seeing a counselor or you are a counselor, you know that therapy for trauma is to process and release it. Like, let it go, because your body, if it holds on to trauma, will produce mental health symptoms, depression, anxiety, or even physical symptoms. And so we need to let go of that trauma. But how could we dare let go of our child, of our loved one, of our spouse? Is it more than grief? Likely. It's trauma. And so I need you to think about this as like a enmeshment that you are trying to pull apart. Because what does trauma do? Trauma changes the way you think about the world, think about yourself. You could begin, and you probably are, sitting in rumination and like saying a negative dialogue to yourself. Oh, I should have done this. If I would have done this, it would have been different. I wish I was a better mother. I wish I was a better spouse. That's negative self-talk as a result of the trauma. That's not grief. I have this thing that I call controlled grief. Because if you don't feel the pain of grief, it will pop up at unexpected times, right? And so I take the time to bring that grief to the surface. But if I start thinking negatively, or I start having visions of the day that I found my daughter, or the day that my son died, or the day that he broke his femur, like the trauma associated with that loss, that's not grieving. That's trauma creeping in. So if you're seeing a counselor, if you're trying to work through this grief, from a 5 stages of grief process, take a step back, take a deep breath. Is it more than grief? If you are talking negatively to yourself, if you are anxious, if you are depressed, it is more than grief. Honestly, I don't like that whole prolonged grief disorder diagnosis, but it's there, and if that's what we have to go with, it doesn't mean that there's something wrong with you. Losing a child, losing a spouse, losing your mother can be traumatic and can take 5+ years of actively grieving to feel confident in that grief. And that's what I have felt with losing my children. The first year is a blur. I don't even know what happened. And then you have me like actually trying to work through these things. And as I've learned how to work through them, this is what I do. I share the wisdom that I've gained from turning my pain into purpose. So what are some questions? I have someone that asked, I lost my daughter 2 years ago. Do I have prolonged grief disorder? Well, technically by the DSM, you have prolonged grief disorder. But remember I said I don't really like that diagnosis. It makes it sound like you have a disorder, and a disorder is somehow permanent or bad. So we just have to reframe the way we look at that. Technically, you are still grieving after 1 year, and it is impeding function. So everything in the DSM, if it is impeding function, if you are having trouble functioning, struggling with anxiety and depression and these kinds of things, and then you do have prolonged grief disorder. But don't think of that as something wrong with you. In traumatic grief, I think it's normal. And maybe it's because, 1 year was nothing for me. But let's change that narrative. And don't be afraid of that diagnosis. And actually, the second question says, well, my counselor diagnosed me with prolonged grief disorder. Is she wrong? Okay, there's 2 factors here. And I explained the whole DSM, impeding function. If you're going to a licensed counselor for her documentation, her or his documentation, you must put down a diagnosis, right? Like, especially if you're billing insurance companies, you have to put something down. Like, this is the problem that we are addressing here in counseling, right? And so, again, don't get stuck on it. It's not who you are. It's not a problem. It's not that there's something wrong with you. We don't talk about grief in our culture. We definitely don't talk about traumatic grief. We don't talk about, how do you function after losing a child? So don't take that to heart. Just try to learn from this experience with your counselor. It has been several years since my daughter's death. And how do I communicate with my support system that I need time? This is good, because it's good that you're asking this question. It is like a struggle when your support system begins to go back to life. Like, they have grieved, they are moving on. Hate that word, trigger word, right? They are trying to function in the world, and you are still struggling. I want to challenge you to try to function, right? That is super important. But there's no reason why you can't say, I need 1 hour, 2 hours, 5 hours a week to go to a counselor, work on these things, right? But what I don't want you doing is not functioning at all. Like saying, I need to work on myself, and so therefore I'm not going to go back to work or take care of the kids. Because if you're that far down not functioning, you need to be challenged to try to do some things. And then if that weight is so heavy, you might actually be experiencing clinical depression, not just depression from grief, right? And if you're experiencing clinical depression or clinical general anxiety, panic anxiety, then you need to address that from a medical standpoint. But I would never tell someone not to try to function. We've got to get out there and try to re-engage with life. And if we don't do this, if we don't actually process this grief, it comes out in those mental health symptoms, but it can also come out in physical symptoms. Watch my next video around physical symptoms and grief. You can do this.